going to talk about how Black Heart started and our why. We started because in 2014, I had 3 heart attacks over the course of 3 days. At the age of 40, I never would have thought that this would be my story even today. And I think I'm still in shock that this is my story. I am a woman who was what they call educated, had insurance, thin, all the things that you would think prevent me from having a heart attack. That was not the case. Constantly being in touch with the healthcare system, being a military girl, all the things, right? But that didn't save me. And so on April 10th, I'd had my first heart attack. God woke me up at 2 o'clock in the morning. I had all the textbook symptoms. Left arm was numb, right arm was numb. Chest felt like a pill was stuck. My neck felt discomfort. Woke my husband up and said, hey, something is wrong. He asked that I need to get to the emergency room. And so that's what we did. We drove to the emergency room just to be told, in a sense. We waited a while and went home and told that I might be having a heart attack, or he wasn't sure because, what'd he say, like?
He said, everything that you're describing sounds like a heart attack, but I know it's not a heart attack because you're too young and you're fit. So she passed the eye test, which overrode everything that she had just said. So what it says is, you're not hearing me, you're just looking at me. And we know now that's it's happening far too often. You know, you pass the eye test, so you're being very dismissive as it relates to what I'm telling you. And that was the biggest mistake I think that we made on the first episode, was not stopping him in his tracks and saying, okay, yes, I hear what you're saying. I passed the eye test, but I'm telling you, even you just said it back to me. You're describing the textbook symptoms of a heart attack. So what I look like shouldn't have even been an issue. We should be addressing what I'm telling you.
And I think what made that I like that, babe, because we can use that, right? When we go to advocate for ourselves, that's the eye test. Now, what are the tests telling us? And unfortunately, in my case, the test wasn't telling them anything. Everything was returning back normal. And so we had instructions to follow with the primary care doctor. But before I could do that, I had another, what we started labeling as episodes in my classroom in front of my students. And so the same symptoms. By the time the fire department got there, I felt fine. I felt fine going to the emergency room. The symptoms had subsided. My husband said, go back to the ER, even though you feel better. Went back to the emergency room, and I encountered, unfortunately, a white female cardiovascular doctor who told me that although I was presenting or telling them that I had the textbook symptoms of a heart attack, she couldn't find anything and they had no reason to keep me, and that insurance would not cover my care. And so going back and forth with her, I didn't think of advocacy. I just thought, well, I know my body and something's wrong. So I'm talking from a sense where I know me regardless of your title. So that's the mindset I have. And whatever is happening, I need it to happen here at the hospital. And so they decided to do a heart enzyme test, which they do in a series of 3. And she said, if it's elevated, that means something's going on with your heart. Well, it came back slightly elevated, and she was still adamant about sending me home. She was like, well, your insurance isn't going to cover it. It's still slightly elevated. So I think we have to take the time to really listen to what they're telling us so that we know how to come back when we're not feeling well. And unfortunately, we should not have to do this when we're not 100%. And so I told her, well, you said if it was off, that means something was going on. So regardless if it's slightly high or low or whatever, it's still not right. So they kept me overnight, and I was released the next day because the test came back normal the next 2 times. Mm-hmm. I'll let you take it from here because I feel like I'm being very long-winded.
Oh, no. Well, I think the takeaway in that piece was, like she said, you know your body better than anyone. So regardless of their education level, regardless of their background or their expertise in the field, I'm an individual, and I deal with me every single day. So when something's off, I know something's off. So again, it goes back to, are you actively listening to what I'm telling you? I'm telling you something is off. So Now it should become about what I'm experiencing versus what you've experienced before I showed up.
Yeah.
So again, it goes back to advocating for yourself and being confident enough in that, understanding what your rights are as a patient and all of those things. And if you don't have the voice, being sure that you have someone there with you who has that voice, and not afraid to use it. You know, that's one of the things in our culture, especially with older individuals. You know, we don't necessarily have the confidence in the healthcare space to speak up for ourselves. So having someone there who's willing to do that is imperative as well. So they kept her, ran the test again. The test came back normal. They sent us home at 11 o'clock on a Saturday morning. By 4 o'clock Saturday afternoon, we were doing 120 back down the freeway, getting her back because she collapsed in the bathroom on the floor. Called me in, said it's happening again. Help me to the bed. I just want to lay down. I just want to take a nap.
Yeah.
You know, and it's funny, when she said it, it didn't register because I remember growing up, when someone didn't feel well, that was the first go-to. Let me just lay down and I'll feel better. Well, I wasn't having it. I said, no, you don't get to die on me today. I don't even know why I went all the way to that, but that's what God put in my spirit. No, you don't get to die on me today. So I got her dressed, we got in the car, we made it to the hospital while all of the symptoms were still there. So they hooked her up to all of the machines and made this huge announcement. Oh my God, you're having a massive heart attack. So 2 days prior, your stress levels followed with your PCP to you're having a massive heart attack. 2 days prior, being very dismissive to, oh my God, now you have 95% blockage in your main coronary artery. 99% blockage. You know, called the Widowmaker. Most people don't get to live to tell the story of the Widowmaker. So we're blessed and fortunate that God was there. He was there the entire time. Even we were self-diagnosing and being dismissive, and because we kind of mimicked the healthcare system. They didn't create a sense of urgency around what was happening, which didn't give us any sense of urgency around what was happening, but it could have been very well a totally different outcome because of that lack of sense of urgency and clarity and understanding. So
yeah, I like that you said the I statement a little bit ago, because it does, instead of comparing me to every patient you've seen in the past, it becomes an individual situation. And don't box me in because I'm not presenting as a woman the way you think I should present. And so when we go into the healthcare system, especially as women, no matter what color you are, you know your body better than anybody. And unfortunately, a lot of times we have to educate them about us because they have been indoctrinated. I hate to say it, you know, a lot of times with the way the medical system teaches and then what they see in hear from their colleagues. So for us, it's always this constant having to remind them when we're in care that no, this is about me. I don't care who you've seen. I don't care what you've seen. This is what I'm experiencing now, and it's not right for me. So it becomes a very personal situation, and it's almost like criminal justice when we run it. How we teach our children, our sons, when they get ready to drive, or our kids about how to engage police officers. We have to know how to engage the healthcare system so that we can make it home back to those that love us. And so to go there, we cannot afford to go to the ER by ourselves anymore. We should have never been doing that, especially with our elderly. We have to be there at doctor's visits. We always have to be there because we're not 100%. Like, I'm not in my right mind if I'm thinking I'm having a heart attack. So I need someone there that's going to advocate for me. I always say, bring that crazy aunt or that loud cousin. Yes, that is bold, and make that noise. No matter if they do label you the angry black one, I don't care. I need to get back home to the people that love me the most. Had I passed away that day or any of those days, my daughter was in college. We had a son. My son was a senior in high school. These are moments that they need their mother. And so No, we're getting back home. That's the message. We have to get back home. And that's kind of what prompted us when I was in the ICU, fighting for my life, going through all of that. What we didn't say is that I had to be rushed back. I died on the operating table, went into what they call sudden death, went to heaven, and came back here and knew that this was the call for my life. God knew that nobody else would do what he has assigned me and us to do for our community. And so I don't bite my tongue when I say that in our community, we have the ability to save ourselves. We are smart enough to create systems that would truly look out for us. And we learned that off the back of our ancestors. They were saving us, even though, unfortunately, a lot of them lost their lives because of those freedom fights. But we know enough. We're smart enough. We created all of this. We built all of this. So we have to go back to what we've been taught and what we know, and go back and bring that forward. And that's what I'd like to say that we've done at Black Heart Association. We are the first of our kind not to offer mobile services, because there's many mobile services, but we go into places and push in where people don't expect us to show up. We're a lot of times we're at the family reunions, we're at the house parties, we're at so many places. Last year we did over maybe 150 events, and this is our community inviting us to them to come out and offer our services. So we started Black Heart Association after I had did my volunteer services at American Heart, and I just realized there was a gap. And the gap is that this is personal. If we're dying the way you say we're dying in the Black community from heart disease being the #1 killer, then why are we not out in our communities having these face-to-face conversations? And so that's what I wanted. I was like, this is personal. So if we save one individual, we save a family, we save a community, right? And so in Dallas, where we started, heart disease deaths in our Black community are down 34%. We hope to spread this across the nation. We can't do this without support, but we hope to have vehicles all over the nation meeting our community where they are. This tour that we're on is called Guard Your Heart Tour. As you know, we're believers, and we cannot do this without Christ. He has really sketched this path out for us. And so, all of him. Yes. Amen. All of him. We can't do it without him. So we're here today screening. We do all kinds of screenings. You want to talk about that, Faye? Well, let's go back. Go back to the conception.
I want to go back because one of the things we're here talking about healing. How do we heal the Black man, Black woman, the Black family, the Black community through healing Black systems? I think we have to go back to the word healing itself. Very simply, it is to return something or someone back to a state of wholeness. If we think about going back to what she mentioned, our ancestors, but if we think about when we were really, really, really in, quote unquote, the struggle, and we were connected as a culture, as a people, as a community, really wrapping our arms around the idea that it takes a village. As crappy as our situation was, we were so much more whole as a people. And I think if we really wrap our minds around that idea with the resources that we have as Black people now, if we could lock arms and wrap our minds around that, we could definitely heal each other and heal our community. I don't want to say heal systems, because I think our systems need to be our systems. Let's not heal broken systems. Let's rebuild the systems that we know work for us. And we have a model that we follow: no cap, all care. So in today's culture, for the youngsters, cap is basically anything that's inauthentic, anything that's unreal. When we approach any individual, any event, we go with no cap. So no condescending tones, no condescending posture, no behaviors that create barriers to reaching our people. We want to be compassionate. We want to be affirmative, because we want people to understand that for some people, getting to you was a battle. So we want to acknowledge that. We want to make sure that there's no pride involved. We want to be very protective and very, very, very respectful of the people that we encounter. And we want to be efficient, effective, and more than anything, we want to be empowering.
Yeah.
You know, we don't want to just provide screening numbers without providing you tools to help you turn those numbers around if need be. We don't want to just provide you with information about where you are or what you have been doing wrong, but hey, here's how to right those things. Oh, if resources are an issue, let's talk about that. So we really grab a hold of these people and love on them more than anything, because it's, again, guard your heart. All things flow through the heart. And if we can lead with love, then the rest will follow. And I think that's a big part of how we've been able to impact the way that we have, because at the end of the day, when I interact with you, I'm interacting with my mother. I'm interacting with my grandmother, my father, my uncle, my aunt. So I think that's a big piece in this care space that's missing, the actual care. So if we can get back to caring, then the health part will come along. And that's what we try to hang our hat on. That's why we go into unconventional spaces. We want to break down any barrier that prevents you from receiving the care, the information, the empowerment, the love, the laughter that you need to be whole again, to heal.
And I would say we're dying. It's a real reality out here. Like, a lot of us have high blood pressure. A lot of us have cholesterol issues. A lot of us are stressed. A lot of us are lacking spiritually, because heart health is a whole picture. It's not just this one thing. It's not just exercise. It's not just eating right, but it's prayer. It's meditation. It's being one with the Father. All these things impact our heart health. When just coming here, we were talking to someone. He's a father. He's a grandfather. His blood pressure is 230 over 150, and he was refusing. He left the hospital. And this is what we're dealing with in our community. So how do we get our, the men that's the cornerstones of our communities? Our men are the cornerstones of our community, and we need them here and whole and well. And so we're having these conversations. We get the calls at night when the woman is being turned away from the hospital, encouraging her to go to the next hospital. When the truck driver is driving 4 hours from Houston to Dallas, but he knows something's not right, encourage him to stop to get to the hospital. As wives, we're trying to make sure our husbands are healthy. As husbands, we're trying to make sure our wives are healthy. And our sons, all the things that make us whole. And so I want us to know that everything, like my husband said before, impacts the heart. If you have high blood pressure, your heart is impacted. If you have cholesterol, it's a silent killer, just like blood pressure. We're not talking enough about high blood pressure and kidney function and getting to a specialist, and all those things are impacting us. And stress. My heart attacks, as far as we know, is stress-related, stress-induced, childhood trauma, all the things that we don't, all the things that happen behind closed doors that we don't speak about in our community. We have to begin to unpack that trauma. As a counselor, I'm a counselor. Before I was called to Purpose, he was an educator before he was called to Black Heart, which is now our purpose. So we have to unpack it all and move forward and heal collectively together as a community. We're looking for scientists to partner with. We're looking for technologists to we're looking for our community to help us build this out. We cannot do Black Heart Association by ourselves. So we need it. So we hope to partner with everybody, because that's what makes this bus go forward. Our community drives this bus. And I say that, I mean that. We don't look for events to go to. Our community calls us and says, we need you here. And guess what? We pull up. We get the calls. We were just in Dorita, Louisiana about a week ago.
Yes.
32-year-old father lost his life in the high school that he graduated from. He went back to teach at. He lost his life in the gym while his kids was in the next gym playing. And so he died from a massive heart attack. The wife called us and asked us to come screen her community. We don't want to be reactive. We want to be proactive. So we hate to push in after it happens, but we get it. It just happens that way. But we matter. We need our community to know that we matter, and we deserve to be here healthy, whole, and well.
What she said.
Any questions for us? So let me tell you the services we're offering today before we get into questions. So today we're offering lipoprotein A, which tells you the possibility of you having a heart attack or stroke in your life. So it's not attached to your lifestyle choices, but your genes. So please make sure you get over to our booth. It's free. Everything we offer to our community is absolutely free. We're also doing a total cholesterol panel as well. The lipoprotein A test is not covered by insurance, but we cover it for you, so don't forget that. So we're here until Sunday, so bring your family, your friends, and all the people and say, hey, we need to get here, because if you don't want to walk them out in my shoes, and I speak for those who have passed away that don't get to talk about their journey through heart disease. A lot of us don't make it. I was just fortunate enough to make it.